So dear students, today we will talk about appendicitis. Appendicitis is acute inflammation of vermiform appendix. So when inflammation occurs inside the appendix, that is called as appendicitis or acute appendicitis. So it is known as most common surgical emergency. So the most common surgical emergency is appendicitis or acute appendicitis. So what is the age at which the appendicitis occur mostly? That is peak age, and it is from 10 to 30 years. So in between this time, the most common occurrence of the appendicitis occur. Now if we talk about the causes, so causes of appendicitis in adults and in children we will discuss. So in adults, the most common cause is obstruction by feculith. So feculith causes the obstruction inside the lumen of the appendix, and that is most common cause of appendicitis in adults. And if in children we talk, this is lymphoid hyperplasia. Lymphoid hyperplasia is the most common cause of appendicitis in children. So this is the children, and that are the adults. So you should differentiate the cause between the children and adults. So these are the causes of appendicitis. Now if we talk about the clinical features, so in clinical feature we see that there is obstruction, and thus intraluminal pressure is increased. So inside the appendix, the pressure, that is luminal pressure, intraluminal pressure, that is increased in case of appendicitis. So what symptoms actually we see in case of acute appendicitis? First of all, there is pain, but the pain start peri-umbilical pain. So the pain will be present, but this pain will start in the para-umbilical region, and this will shift to the right lower quadrant because of the involvement of the peritoneum. So this is, let's say this is the left side, this is the right side, and this is the umbilicus. Now initially the pain will start para-umbilically, and it will go toward the right lower quadrant. So this is the shifting or radiation of the pain in case of appendicitis. So initially if patient say I have para-umbilical pain, and if he say I have right lower quadrant pain, so these both are related to appendicitis. Other symptoms that we will see are anorexia and nausea, and vomiting will also occur, and low grade fever will occur. Because it is inflammation, then the low grade fever will also occur. Most important, we have some signs that we will discuss over here. There are some signs that are very, very important, and you should know this with respect to exam. And these signs mostly are asked in clinical exams or also in YWAS. So first of all, we have a sign that is called as a McBurney point tenderness. We have a point that is called as McBurney points. So what is actually McBurney point? McBurney point is, let's say this is abdomen, and this is the umbilicus, and this is the interior superior iliac spine. So if we go from umbilicus toward the interior superior iliac spine, and we divide this part into three parts, so the part that is marked by the red is the McBurney point. So this is the McBurney point here. At this point we have tenderness. Tenderness means when we touch this point, then the pain will occur, and that is actually right lower quadrant pain. So right lower quadrant tenderness. So right lower quadrant or McBurney point tenderness that we see in case of appendicitis or acute appendicitis. Then we have rebound tenderness. Rebound tenderness means when we press the abdomen, and when we remove the finger or hand by which we are pressing the abdomen, then the pain will occur. So the pain actually does not occur on pressing, but when we release the hand, then the pressure, or we release the pressure, then the pain will occur. So pain on release of pressure, that is called as a rebound tenderness. So this is another sign. Next we have Rovsing sign. Rovsing sign is what actually right lower quadrant pain when left lower quadrant is palpated. Let's see. First, let's see. This is the abdomen, and this is the left side. This is left side, and this is the right side. If we press this left side, the pain actually felt in the right side. That is called as a Rovsing sign. So when right lower quadrant pain occur when left lower quadrant pain area is palpated, this is called as a Rovsing sign. Then we have another sign that is Psoas sign. Psoas sign is actually a pain that occur when hip extension. So when we extend the hip and the pain occur, that is called as a Psoas sign. So actually, let's say this is a patient that is lying in lateral decubitus position. This is patient lying in leaky. These are the legs of the patient. Now what actually happen in this case? If I extend the hip in this way, then the pain will occur over here in the affected side, then that is called as Psoas sign. So Psoas sign actually mean this thing. So Psoas sign is pain when hip is extended. So hip extension causes the pain, that is called as Psoas sign. Then we have another sign that is Obturator sign. Actually, what is Obturator sign? It is a sign where pain with internal rotation of flexed hip. Let's say we have a patient that is in supine position. This is a patient in the supine position, and these are the legs of the patient that are flexed. Now let's say I am touching, this is the right side of the patient and this is the left side of the patient. Now if I rotate these, cause the internal rotation of the hip, then the pain will occur over here. That is called as obturator sign. So what is obturator sign? This is a pain with internal rotation of flexed hip. So these are the some signs that are related to the appendicitis. Now we will talk about the diagnosis. So in case of diagnosis, what actually we do some lab investigations, we do imaging, and most importantly Alvarado score, that is remembered by the mnemonic mentals. So in lab investigation we do CBC, and in CBC we see leukocytosis, elevated level of T. So then we see elevated CRP. So these are increased. So leukocytes, white blood cell are increased. TLC, total leukocyte counts, is increased. So leukocytes are increased. So TLC is increased, we can say, in CBC report. And we also have elevated CRP, that is inflammatory markers. So in imaging we do ultrasound and CT scan, and that is more sensitive and more specific. So more specific and more sensitive is CT scan. Now we check for Alvarado score, that is remembered by mentals, and each word in the mental has its own full form. So what are the parameters that are and what are the scores that are related to these parameters? So if patient is here from M, mean migration of a pain to the right lower quadrant. If patient has this symptom or sign, then the score is given as 1. Then if patient is anorexia, then 1 score is given 1 mark. Nausea and vomiting is given 1 mark. Tenderness in right lower quadrant, if there is a tenderness in the right lower quadrant, this is given as 2 marks. This is important, sometimes asked in the exam. So we have 2 things that have 2 marks. R means rebound tenderness. When we release the pressure and the pain occurs, that is rebound tenderness, and it is given 1 point. Then we have E means elevated temperature, that is given 1 point. And now most important is leukocytosis. If we do CBC and the elevated TLC, total leukocyte count is elevated or increased, that is given 2 points, and that is important. And now we have shift of a white blood cell to the left. This is mostly explained in the hematology, but here we will say that shift of white blood cell to the left means that much immature cells are present, that is given as a 1 point. So total score is 1, 3. Total score is 10. Now if we calculate, now we will do interpretation. In interpretation, if the score is 1 to 4, this means low probability of appendicitis. If it is 5 to 6, this is possibly that appendicitis has occurred, and now we will do imaging, or we will do observation to and further checkup to confirm the diagnosis of appendicitis. But if the score is 7 to 10, then it is high probability, and we do surgery in this case. So if score is 7 to 10, then this is a high probability of appendicitis, and we do surgery in this case. So this is the Alvarado score. And now treatment, if we come to the treatment, the most suitable treatment is the appendectomy, that is a surgical removal of appendix that is inflamed. So this is the acute appendicitis.